Uh, a very good afternoon to all, especially coordinator for this month, Professor Dr. Anukul Chandrakar sir, and today's special guest speaker, Professor and Dean Pradeep Kumar Panda sir. First of all, I would like to congratulate Dr. P.K.Panda sir. Recently, he has been selected as a chairman of Clinical Research Scientific Advisory Group in CCRS, New Delhi, Ministry of Ayush, Government of India. So on the behalf of Academy, we all congratulate you, sir, and also welcome all the respected teachers and some students who have joined for today's lecture. And to introduce Professor P.K. Panda, sir, I invite coordinator, respected Anukul Chandrakar, sir. Please introduce Panda, sir. Hello. Sir, please unmute yourself.
Yes, good afternoon, everybody. It is our privilege to have Dr. Pradeep Panda sir as a guest speaker today. And just to introduce, he's a very big biodata, just I will brief. Recently, I also congratulate him joining as a chairman, Clinical Research Subgroup, Scientific Advisory Committee of CCRAS. Dr. Panda is graduated from Gopabandhu Ayurveda Mahavidyalaya, Puri. In 1986, and he was just 4 years senior to me in UG college, and he did his MD in Rog Nidhan and Vikriti Vigyan from BHU and completed his MD in 1992. Then he has done his PhD from Samprananda Sanskrit University in 2005, and he also did postgraduate diploma in hospital and health management in 2005 from Indira Gandhi National Open University. He served as a Ayurvedic medical officer, started his career as an Ayurvedic medical officer, and then joined as a lecturer in 22nd September 1998, and promoted as a reader from 4 December 2009, and as a professor from 30th April 2012 in Government Ayurvedic College, Balangir. He has been assigned so many administrative posts. He acted as also Secretary Teacher Council, Government Ayurvedic College and Hospital, Balangir. He was also coordinator PhD Nodal Center, Government Ayurvedic College, Balangir, and he was also in charge Deputy Medical Superintendent, Government Ayurvedic College, Balangir. A major academic achievement, I think he has had more than 28 years of teaching experience, and along with excluding 3 years PG teaching experience, and he has supervised 12 MD students and total 19 PhD candidates he has supervised. The main research work he has completed evaluation of safety and efficacy of Li-52 tablet in the management of alcoholic hepatitis, sponsored by the Himalaya Drug Company. Then evaluation of efficacy and safety of Ayurvedic drug on hypoglycemia in pre-diabetes and diabetes. These two projects he has published several research papers in sickle cell anemia, especially on sickle cell anemia, and he has published Rogi Pariksha Part 1 and Pothi Pradeepa in Odia language. He has published 2 books. Now, regarding his awards, he was awarded Fellowship of International Academy of Ayurveda Physician and Fellowship in Indian Proctology Society, Nidana Ratna and Nidana Ratna Award by Indian Proctology Society, Bhubaneswar. He has been an examiner into various universities, including BHU also. and the major scientific research works he has to his credit. There are so many papers published in research journals in international and national repute. So with this brief, now he is working as a Dean of Sri Sri Ayurvedic College, Ayurvedic Sciences and Research Hospital, Cuttack. And recently, you all know, again, I am congratulating him for joining as a scientific advisory committee chairman of subgroup clinical research at CCRS. So with this brief introduction, I just hand over this to Dr. Kohli.
Hello. Respected Panda sir.
Yes, yes.
Hello. Yes, sir.
Yes.
Shall we start, sir?
Achha, okay, okay.
Okay, sir. Yes.
Good afternoon to everybody. First of all, I have got opportunity to share my research work based on sickle cell anemia. So in this regard, we have with our President, Professor Pavan Kumar sir. Congratulations from my side also. He has recently get opportunity to be the chairman of Basic Science and Fundamental Research of CCRS. Best wishes from my side also. We have with our secretary, Dr. Atul Varsneji. We have with our coordinator, Professor A.C. Karji, and convener, Dr. Ganesh Koleji, along with all the professors, associate professor, assistant professor, PG, PhD holders of our Nidana groups and other dignitaries, those who are linked with these lectures. Yes, I have been assigned to have a lectures regarding before that, I pray to our Jagannath, Lord Jagannath Nilachala Nivasaya Nityaya Paramatmani Balabhadrang Subhadrabhyang Jagannathaya Te Namaha. Along with our God Dhanantari, my topic is sickle cell anemia, its interpretation and research-based prophylactic medication. One thing, there is no word at sickle cell anemia in Ayurveda, but we have to correlate different clinical features found in case of patients that can be correlated with the disease anemia, and after that, after pathological investigations, the patient is being diagnosed as a sickle cell anemia, then we are trying our level best to take prophylactic management, what are to be needed for that patients. What is sickle cell anemia? Sickle cell anemia is a form of inherited blood disorder, affects the red blood cells, turning them from round flexible discs into stiff and sticky sickle cells. Sickle cell also do not live as long as the normal RBC. The lifespan of a normal RBC is 120 days, but the sickle cell RBC lifespan is only 20 days. So as a result, do not have enough healthy red blood cells are found in our blood. That's why there is a development of anemia, and when that anemia is having the clinical features with all the anemia clinical features along with the pathological investigation, when we receive that in SB electrophoresis the patient is suffering from sickle cell trait or disease or thalassemia sickle cell, then we call them as a sickle cell anemia. It is not directly mentioned in Ayurvedic Samhitas, but there may be considered as a Anuktaja Vyadhi. It can be correlated with the Sannipatika Pandu as regards to the clinical features narrated by the Samhitas. So the sickle cell is a genetic abnormal disease considered as a Sahaja Vyadhi in Ayurveda. If we will go through the armamentarium of modern science, then we can get that the sickle cell disease at a glance means the sickle hemoglobin S forms due to the mutation of the beta gene cell that is in chromosome 11. Then chromosome 11 is a chromosome where in the 6th position of this chromosome, where there is glutamic acid is replaced by the valine, then that chromosome is being abnormal. And after that abnormality, that the disease is being started. It is commonly noticed among the tribal peoples and transmitted on the basis of the Mendelian's inheritance. It has been observed that not only in India but also abroad, the sickle cell anemia is being flourished nowadays. It is the haplotype of disease where in different countries is being named as that one. As for Senegal and Benin and Central Africa Republic and Comoros and Arab India, there in that places, the fundamental things that the chromosomal abnormality we can found in all and every cases, but the constituent of individual produce different types of clinical features. In some cases, there may be chances of loss of blood. In some cases, there may be chances of pain in joints or pain in abdomen. That on because of that clinical features, they have given that types of name. The classically, mainly according two types of genetic configuration are seen. One is homozygous state and another one is heterozygous state. Homozygous state means sickle cell anemia, we told that, and in heterozygous state it is called as sickle cell trait. After the disease, there may be chances of involvement of major organs of our body. This is about the gene mutation and types of sickle cell anemia. You see, if father and mother both are affected with sickle cell trait, and if they have born 4 childs, out of that one will be typical, where there is no chance of blood disorders, and among them 2 are only the sickle cell trait, and one is sickle cell disease, where HBSS chromosome is found on sickle cell anemia. And sometimes it has been observed that beta thalassemia also come in contact with this anemia, and that is called as sickle beta thalassemia. So there are mainly 3 types, so we can calculate them. The one is homozygous, that means SS band of sickle cell anemia. There is heterozygous, means AS band of sickle cell anemia, and the compound heterozygous means sickle beta thalassemia. If you will go through the history of the sickle cell anemia, we found that in 1870, first described the African medical literature that there is a disease like sickle cell anemia, but at that time there is no such investigation procedures that can be diagnosed as a sickle cell anemia. But it has been observed that some of the patients are having anemic condition and they are frequently died. Only because of that they have tested the slides, and they come to the conclusion that there is some abnormality in the RBCs, which is not being properly diagnosed by themselves. In 1910, first case of sickle cell anemia was described in US. He was a medical student, and it has been published in a journal by Dr. James Herrick. In 1911, Benjamin, a 4th year medical student of UVA, published the second case reported as a sickle cell anemia. In 1907 to 1918, the patient Ellen Anthony frequently received the charity care from the UVA hospital, and he came to know that there are so many patients come to him for the treatment of this anemia, but it has not been properly diagnosed. In 1963, Sri John Desai sickle cell anemia was essentially a disease of childhood declared by them. And at that time, what happened in 1973, the lifespan of these affected peoples was 14.3 years, and 20% of people population of childhood died within the first 2 years of the lifespan. After that, in 2000, nearly all patients survival to adulthood. It is only because of they have taken different types of vitamins and immunomodulator drugs, which helps to enhance their lifespan. If we go through the global disease burden of sickle cell disease, we come to know that most of the African peoples are affected with this disease, and along with other America also, and India is also suffering from that. The disease burden of the sickle cell disease in India, it has been observed that the middle part of the India, like Odisha, Chhattisgarh, Maharashtra, Madhya Pradesh, Gujarat, they are more affected with this sickle cell disease. Out of them, Chhattisgarh is 20 to 41%, Maharashtra 2 to 35%, Madhya Pradesh 10 to 33%, Gujarat 6.3 to 22.7%, and Odisha 5 to 20% in the tribal population. As regards to the burden in Odisha, it has been observed that previously Odisha was 13 districts. Accordingly, it has been observed that the western belt of this Odisha is being suffered by the sickle cell anemia. Out of them, the Koraput, Kalahandi, Dhenkanal, Balangir, Sundargarh, Sambalpur, Fulbani, they are more prone to this type of disease. It is only found in case of tribal peoples. Before going to start the sickle cell anemia, to have a knowledge about this hemoglobinopathy, we have known that the RBC, inside the RBC there is hemoglobin molecules, and each hemoglobin molecules having four iron molecules and 4 protein chains. Out of 4 protein chains, 2 is the alpha chain and 2 is the beta chain, and they are arranged in such a way that is a helical shape of polypeptide molecules, and that polypeptide molecules, when they contact each other, they form this hemoglobin, and that hemoglobin is present inside the RBC. So before that, we will go for this what is hemoglobin. There are 2 main diseases are seen from this hemoglobinopathy. One is the thalassemia, and the second one is the sickle cell anemia. Thalassemia is the only because of the quantitative defective, but in case of sickle cell anemia, it is a qualitative defective. In qualitative defective, what happened? The normal synthesis of an abnormal hemoglobin, abnormal protein is being seen, and that is due to amino acid substitution. In 6th position, glutamic acid is substituted by valine, and due to that condition, there may be chances of heterozygous and homozygous state. Heterozygous is the trade form, and homozygous is the disease form. There are mainly adult hemoglobins and fetal hemoglobins we are seen in our day-to-day practice. Adult hemoglobin is 3 types. One is HbA, second one is HbA2, and third one is HbF. I have already told that each hemoglobin carries 2 alpha chain and 2 beta chain. That is the major adult hemoglobin. If you will count that, the 95% total hemoglobin is about the HbA, and it is found in all cases. But in case of HbA2, that is formed by alpha and delta. Delta is one type of protein chain found in also in chromosome. I will see you the graphs, which is very easy to understand all these things. And the third one is the hemoglobin F. It is also formed by the 2 alpha and 2 gamma. It is about 1%. As regards to the fetal hemoglobin, there is alpha 2 and gamma 2. Instead of that, there is HB, GUR 1 and GUR 2. These are the only found in the gestational period. Later on, it is not found after delivery or after birth. But what happened? The fetal hemoglobin sometimes found up to the age of the 2 years. You see, this is the status of the hemoglobin in human. Before, you see, the before birth, there is the development of alpha and gamma. After that, the embryonic protein like eta and zeta is being started from the zygote form and up to the 4 months. Then after it is reduced and started by the beta protein chain, and alpha, beta and delta, that is continuing till our life. Before going to discuss about this sickle cell, how and in which way it creates problem, I am forwarding a video. You can easily find out this situation where you can easily diagnose the patients by sickle cell anemia. You see, this is the sickle cell anemia in the inherited disease that turns to healthy red blood cells. Now, abnormal sickle cell red cell which can come in contact with us, tissue infection, joint and abdominal pain, among others. But what causes sickle cell anemia? What is the synthesis of hemoglobin S? So this is the erythroblast. Inside the nucleus there is chromosomes, and 11 chromosomes is only responsible for that. There is DNA and mutation of the beta globin chains. RNA polymerase, when mixed with DNA, synthesis the messenger RNA, and that messenger RNA encoded with the nucleus and enter from the end, come from the nucleus and come contact with the ribosome, and there is messenger RNA, and from the messenger synthesis of beta S globin, and that beta S globin meet each other. And I have already proved that each hemoglobin having 2 alpha and 2 beta chain form a tetrameric, that is alpha beta S genes, and there are 4 iron moiety contact with these protein chains and forms 1 hemoglobin molecules. And that hemoglobin, if there is S molecules, that is called HbS molecules. How does sickling occurs? You see, this is the healthy hemoglobin HbA. These are the oxygens. There is the oxygenation. Again, deoxygenation procedure is continuing in our body. Mutant hemoglobin molecules, HbS. There is oxygenation and there is also deoxygenation, but DPH is found, and deoxy HbR found inside the blood. Also, deoxy HbS is also found inside the blood. When they are HbS, they come contact with each other, they forms polymerization, and that polymerization come contact with these blood cells, and that become shortened, less flexible, and form the sickle forms. And that is a typical sickle form anemia. And oxygen function and imbalance changing in the blood cell membrane. You see, this is the HbS polymerization. There is free oxygens inside the blood, and when they are not contact with this Hb, they are become free radicals are increased among them, and that free radicals come contact with the superoxide action, come contact with the cell wall of the RBC, and there may be chances of the damage of the RBC membranes, and that RBC membrane activate oxygen and deoxidize the HbS molecules, turn to the mega HbS, and that mega HbS molecules come contact with each other and form hydrogen body, and that body will come contact with the cell wall of this RBC and become tattered form and arrange in such a way that they damage the cell walls and exposing different cytokines sickling consequence. You see, when there is the sickling form, they come contact with the vascular occlusion, and after vascular occlusion, there may be chances of swelling of the hands, and there is macrophage. When come contact with the RBC, sickle RBC, they engulf that one, and there is different activities of phagocytic action and release the cytokines. That cytokines come contact with this nervous systems and enter to the nervous system, creating abnormality in the neurons, and there is chances of vaso-occlusion. There is increase the heart rate and blood pressure. There is a metabolic disturbances. There may be chances of increase the body temperature and also pain in the body. This is about this, how and in which way sickle cell occurs. Now, we'll go through these types of Pandu. As I have already told that the clinical features of this sickle cell anemia may sometimes correlated with the signs and symptoms of Sannipathic Pandu. So we have a knowledge about this Pandu. There are 5 types of Pandu: Vataja, Pitaja, Kaphaja, Mudbhakranaja, and Sannipathic Pandu. And there are different clinical features or signs and symptoms. We are found there: fever, diminished sensation of motor functions, emaciation, fatigue, thirsty, and others. We have already have a knowledge about the etiopathogenesis of Pandu Roga. Vyamamla Labrani Mud Madhya Diva Sopna Ativadiknam, Nisebya Manasa Padustan, so Dosato Panduratani. These are the pathophysiology of Pandu Roga. And these are the etiology of the Pandu Roga, which has already been described in a various Ayurvedic context. And also this type of food, if we are taking regularly with the sickle cell anemia, there may be chances of complications and manifestation of acute and chronic sickle cell disease. This is the pathophysiology between this Pandu Roga, Samprati Vigatana, and we have go through the Sanchaya Prakopa Prasara Thana Sakshan, the Vyakti Bheda. These are the process by which Pandu Roga develop in our body. And the Prodomata, Tox Potona Stibana Gatra Sata, Mut Bhakkana Prekhana Kota Sutha, Vimruta Pitata Vipaka, Bhavishati Dasya Purasarani. These are things, and the principle of treatment is according to Ayurveda. If the Bhataja Pandu, there is chances of we are going through the Sneha procedures. If Pitta, there is Tikta and Chitta, and Kaphaja, there is Kotu, Tikta, etc. And in Sannipathica, there may be chances of taking all types of principles which has already been introduced in Vataja, Pittaja, and Kaphaja. I have already told that there may be some relation or some consequence with the Sannipathic Pandu and sickle cell anemia. You see, the red color is the clinical features of the Sannipathic Pandu, but the black color is the clinical features of the sickle cell anemia. It doesn't mean that the patient, those who are suffering from Sannipathic Pandu is equal to the sickle cell anemia. No, it is a wrong concept. But some of the clinical features of sickle cell anemia is correlate with this Sannipathic Pandu. Among them, Gatrasula, Sotha, Jwara, Drabalya, Srama, Pitta, Vartanata, Udarasula, Swasa, Kasa, Rudroga, Panduta, Toxputana, Aruchi, Jakrut Priya Bruddhi. These are the clinical features we have already seen in our text, and also a day-to-day practice in Sannipathic Pandu we are taking into consideration. And the black color is the clinical features of sickle cell anemia, which are also being received day-to-day during treatment of the patients. You see, what is the consequence, how and in which way sickle cell already being started. I have already ventilated to you or showing this video where you can easily understood that how and in which way this sickle cell is formed. The first one is the HBS polymerization, then sickling, then hemolysis, then come to the anemia. You see the pathophysiology behind the sickle cell. The first one is the HBS polymerization. When the oxygen tension is reduced, there may be chances of tactoid formation of the hemoglobins inside the RBC, and there may be chances of hemolysis. When there is hemolysis, there is chances of endothelial dysfunction. When there is endothelial dysfunction started, that time hemoglobin is being derived out from that hemolysis and come contact with sickling form, and after sickling form there is vasoconclusion, and there is chances of sterile inflammation inside the body, and different clinical features we can see our day-to-day practice, which has already been used in the videos. You see, there may be chances of two types manifestation. One is acute manifestation and second one is the chronic manifestation of sickle cell disease. In acute manifestation, there may be chances of recurrent infection, splenic sequestration, aplastic crisis, acute chest syndrome, and stroke. But in case of chronic manifestation, there may be chances of anemia, jaundice, splenomegaly, and other different clinical features like proteinuria, polylithiasis, and restricted lungs disease, pulmonary hypertension, avascular necrosis, and leg ulcer. Like that, there are so many clinical features we have seen in our day-to-day practice. This is the acute complication of the sickle cell disease. First one is the fever, second one is the vaso-occlusion, third one is the chronic acute chest syndrome, fourth is the stroke, fifth is splenic sequestration, sixth is infection. Due to infection, there is hand-foot syndrome or dactylitis, and there is aplastic anemia. These are the acute condition of the sickle cell disease. Second one is the chronic complication of the sickle cell disease. There may be chances of avascular necrosis. Second one is the chronic pain in our joints, renal dysfunction, and pulmonary hypertension, and recurrent priapism. These are the chronic complication we can found day-to-day practice. The complications like first in acute condition, there may be the infection. If that is not being supported by the medicines or by the physicians, that may be due switch over to stroke, where decrease in the oxygen capacity inside the blood flow, and that creates reduce the blood flow to the renals, and there may be chances of renal failure, and then after the heart failure. This is the consequence after the complications. And what are the investigations we need for this diagnosis of the sickle cell anemia? First is hematological investigation, among them CBC, ESR, sickling, biochemical, urea, creatinine, LFT, and lipid profile, HB electrophoresis, urine test, and radiological and USG. These are the investigation we can conduct in our day-to-day practice. You see how and in which way we assess the and diagnose the sickle cell anemia. First, I have already told you that complete blood count. If we will go through the peripheral smear of this blood cells, we can find that there may be more reticulocytes are found. It may be 20 to 50%. There is decreased the hemoglobin concentration, elevated platelets, normal or elevated MCB, crenation of the sickle cell form of RBC. There is anisocytosis, poikilocytosis, Howell body, and basophilic stripling. Occasionally nucleated RBC or normoblast are also seen in our peripheral blood smear. You see the other test by which we can diagnose the sickle cell patient, where there is no facility of this sickle cell test, we can test the sickle torvid tube test. I will show you the pictures where we can easily diagnose this patient is suffering from sickle cell disease. Second one is there may be chances of reducing the RBC only because of heterogeneous placement of this RBC inside this ESR tube. Third one is the hemoglobin electrophoresis. By the help of electrophoresis, we can easily diagnose that patient which is suffering from sickle cell trait or sickle cell disease or thalamic patient. And erythrocyte fragility also decrease due to the osmotic fragility. You see, this is the sickle solubility test, where there is no facility. We can collect the blood inside a test tube, and we should put it for 30 minutes. Then we can easily diagnose that the blood cells are setting in the down part of the test tube. But in case of sickle cell, there is a homogeneous solution like that we can see, and it is only because the turbidity, and from the turbidity we can diagnose that this patient is suffering from sickle cell disease. In case of ESR, there is reduced ESR. We can diagnose from this part also, where there is no facility of the electrophoresis like that. We can collect the ESR, and the ESR is very minimal, 1 to 5. I have seen most of the cases, 99% cases, the sickle cell anemia cases, there is the chances of ESR. But one thing, in case of cardiomegaly disease or cardiac problem, there may be chances of decrease in the ESR. So we have to diagnose accordingly. Either the patient is suffering from cardiomegaly diseases or suffering from hematological diseases. Third one is the HB electrophoresis, by which you can easily diagnose the which type of sickle cell the patient is suffering. Instead of that, there are so many parameters with us to diagnose this sickle cell anemia. First one is the arterial blood gases, which reflects the decrease in PO2 and acidosis. Serum bilirubin, total and indirect, may be elevated. Acid phosphate also elevated. LDH and urine and fecal urobilin is elevated. Alkaline phosphate and serum potassium and uric acid also elevated. Iron elevated. Total iron binding capacity sometimes normal or decrease. Bone radiography shows that maybe chances of osteoporotic changes, osteosclerotic changes, osteomyelitis changes, and maybe chances of avascular necrosis. These are the assessment by which we can assess our patient and diagnose the patient. The proposed line of treatment is, my knowledge is concerned, as there is no such type of treatment based in Ayurvedic. So as it is a disease based on Sanipati Japandu, having more affected with the Pitta Vikara, so we can diagnose the patient as like, and we take the help of the medicines which are help to reduce the Pitta Vikaras in our body, along with analgesic which are available in our Ayurvedic practice. We can use that one. Second one is the hemolytic drugs. We can also treat with them. Immunomodulator drugs, Pitta Rechaka drugs, Tridosha Samaka drugs, Rakta Prasadaka drugs, and Kamalahara drugs, and most probably hepatosplenic protective drugs can act properly in sickle cell disease. What modern science is nowadays giving the treatment for the sickle cell disease, though there is no treatment from their side, they are only symptomatic treatment is being introduced by themselves. They have the treatment with peripheral blood stem cell transplantation, but it is very difficult, and there may be damage of several organs, and there may be the contraindication in all cases. The patient, those who are suffering from sickle cell, there should be the same blood group, and other things should be same. So it is quite difficult to each and every part of this patient to financially and in other cases to take this help. Second one is the transfusion therapy. It is being introduced nowadays, is because there is chances of anemia, and in case of sickle cell anemia HBSS, there is more chances of anemia, and it is only because of mainly lysis of the RBCs and recurrent infection. So this is now being continuing from modern science. The supportive therapy like that, they have already told, they have usually told that you take the hydrating therapies like ORS and other things. But what happened, I have seen that the hydrating therapy sometimes helpful, but if the patient is suffering from infection, so there is no chances of development in his clinical features. So on that case, sometimes there may be chances of pulmonary infections, and pulmonary infections create more problem. It's because if oxygen is not being placed properly inside the RBCs, it is quite impossible on the part of the RBC to make it equal distribution to the all parts of our body. They are using these two drugs, mainly hydroxyurea. It shows that it affects the increasing the fetal hemoglobin. I have already told you that fetal hemoglobin helps to increase the oxygen carrying capacity of the RBC. That's why they are using. But one thing I am noticing here that this hydroxyurea is a Ayurvedic drug that is being patented by the modern science. The second one is the arginine. Arginine is also an anti-sealing property, but enhance the nitric oxide availability, which is a potent vasodilator. So by the help of this vasodilation, there is more chances of blood flow inside the organs, and there may be chances of recovery. As regards to this topic, after joining as a demonstrator at Government Ayurvedic Bolangiri in 1992, in the outdoor, I have seen that most of the patients, those who are from tribal area, they are suffering from anemic, and I have already submitted my thesis in leukemia, so I have a good knowledge about this hematological aspects. So I think that if I will take a risk, how and in which way the sickle cell anemia can be prophylactic treatment can be given to this patient. So after joining there, I personally make different types of procedures of treatment and getting good results also. That is being seen in this slide also. The first one was the maintenance of hemoglobin level and prevention of repeated blood transfusion in sickle cell anemia with the classical formulation in 1997 when I have joined there. Then after a clinical study of sickle cell disorder patient in the hormonal formulations, and third one is the a clinical study of hepatosplenomegaly with classical hormonal formulations with special reference to sickle cell disorder. The fourth one is the clinical pathological study of Panduroga and its management with Raktavasti and Basadi Kwatha Ganabati. In from 4th to onwards, at the time our college is having a PG study in our Rognitan department. So from that one, at the time, there is chances of the PG students, those who are interested for this sickle cell disorder research work. On that case, we are introducing different types of modules, how and in which way we will get some remedy of the sickle cell disease. Then was a comparative clinical pathological study on Ayurvedic formulation in sickle cell with special reference to P.K.Panda. Instead of that, Mojjavasti in sickle cell anemia, a case study is being also conducted by my PhD students, Dr. C.P. Sinha. The clinical pathological study of hormomineral compound and Guduchi Sattva in sickle cell anemia with special reference to P.K.Panda. Anti-sickling effect of Guduchi Sattva and hormomineral compound in different doses, 250 milligrams and 500 milligram dose in sickle cell patient, a comparative vitro study. It has been conducted with the help of Delhi University South Campus. I will show you this figure also here. A clinical pathological study on Plihodora with special reference to splenomegaly, a comparative management with the Sarapunka Khara and Sarapunka Ghanavati. These are the clinical study has conducted in our PG institution at GSC Bolangir. First study was the hemoglobin, maintenance of hemoglobin level. At that time, there is no PG students also. I have only taken into consideration of the 12 patients having single blind study. Age in between was 15 to 60, place of study GSC Bolangir, and the medication was Lakshadi Gogulu and Lokanath Rasa. Lakshadweep was introduced with water after food and Loknath also 250 milligram BD with honey before food. The duration was 60 days. The clinical features which we have taken into the consideration is a fever, weakness, pain in extremity, pallor, yellowish eyes, bone tenderness, hepatosplenomegaly. These are the signs and symptoms we have treated with the 60 days. I have already shown in the PPT that the ingredients of Lakshadweep and broth Loknath Rasa and the what are the signs and symptoms we are taking into the consideration at the time of assessment. These are the clinical assessment. We are come to the conclusion that in fever, weakness, pain in extremity, abdomen pain, liver and spleen and hemoglobin. These are the assessment criteria having subjective and objective parameters. And we come to know into the conclusion that only in case of pain in extremity, there is we cannot get any satisfactory result. Out of that, in case of fever, weakness, abdominal pain, they are statistically significant. But in case of spleen enlargement, it is highly significant after receiving that medicine by the patients. And that clinical study is being published at CCRS in 1997. Second study was the hepatosplenomegaly in hormonal compound with sickle cell anemia. At that time, we are taking 173 patients. Out of that, sickle cell trait is 110, and sickle cell disease is 56, and sickle cell thalassemia is 8. And both sets, the medication was given both Loknath Rasa and Rohitakarista for 30 days. But what happened in that case, in sickle cell thalassemia, none of the patients come into the consideration under our assessment. But sickle cell trait patients are more concentrated with these diseases and giving good result rather than the sickle cell disease. The total clinical assessment has also been narrated here. And on that case, we are getting good result also. In case of weakness, pain in extremity, abdominal pain, liver, spleen, hemoglobin, all of the cases we are getting satisfactory results. You see, the third one is the clinical pathological study of Panduroga and its management with Raktabasti and Basajukata Ghanabati. I came to know that some of the practitioners of Western Belt of Odisha, they are using the goat blood for the treatment of this sickle cell anemia and also getting good result. Why not we can go through the principles of treatment of Ayurveda as a Raktabasti. So I decided, and if PG students Antarjami Panda is interested for was interested for that, and accordingly we started this treatment. We have taken 30 patients, and out of 30 patients, 10% is given with the Raktabasti, and 10% group B was introduced with the Basajukata Ghanabati, and group 3 having the both treatment. And I have narrated here about this both treatment, and both treatment we are getting good results. Out of 10%, sickle cell trait was 7% and sickle cell disease was 3%. And they are giving this Raktabasti as our procedures of Panchakarma. Pre-operative procedure, we are introducing this Snehana Sadhan for 7 days, and 60 ml blood of previously screened donor, those who are having same groups and having no such type of venereal diseases. That patient blood is collected nearby the bed and introduce them rectally. Before that, we have introduced the patient about all these things. Anemia also being given to them half an hour before to evaluate all the parts present inside this rectum. Then in post-operative, that is being continued for 15 days interval for 48 hours. Each 48 hours we are repeating that one, and for 3 consecutive transfusion like inside this rectum. And in 15 days, in 0 day, 15 days, and 13 days, there is a clinical evaluation was being conducted, and total procedure is continuing for 30 days. And it has been observed that this is the pre-procedure Raktabasti procedures. You see, these are the instrument was needed at that time for this Raktabasti. One is catheter, second one is 50 ml 50 ml syringe, disposable syringe, and gloves, and some needles and cottons like that. Now we take the consent of the donor. The donor is having same blood group with we have tested this VDRL test, HIV test, also all other tests. But the patient, those who are suffering, not suffering with that disease, we are taking the consent from that, and we are collecting the blood from the consent peoples. We are introducing that blood immediately after collection from the side by side bed, and administered within 5 days, and the patient is advised to stand still for 1 hour on that bed. After that, the patient is advised to take light foods, and we have tested the patient the occult blood test. Next day, it is found that occult blood test was present only for 1 day. In second day, there is no chance of occult blood test. But one thing is that before introducing this blood through anus, we have taken the pH of this anus, and it has been observed that most of the pH are alkaline in the first time, and in the second time, it is come to the notice that it is being changed to acidic up to the 6 hours. Then it is again changed to the alkaline. This is about the assessment of the clinical features before and after treatment. These are the signs and symptoms, and the right side was the mean value of the hemoglobin and the CBC also. The overall assessment, we come to conclusion that in sickle cell trade, there are marked improvement in 3 patients, moderate improvement in 2 patients, and mild improvement in only 2 patients. The total improvement is 71.42. In case of sickle cell disease, out of 3 patients, 1 patient is moderately improvement, and mild improvement is 2 patients. So there is 33%. We are not considering the mild improvement is because there may be chances of any cause create this mild improvement. The other research has already been conducted in Ayurvedic. Ayurvedic is a herbal product, which is I came to know that some of the patients are not interested to take the mineral product, and it is also come to our notice that in case of there is no defect in the hemoglobin concentration of this body, but only the protein part of the body is being deranged. So if we will introducing the iron containing medicines, there may be chances of hemosideria, and there may be chances of sequestration of the spleen. So I decided that some herbal medicines to be introduced, which are having Rosayana therapy, that means rejuvenative therapy, and there may be some chances of antibacterial therapy, there may be some chances of analgesic therapy, and there may be chances of some immunomodulator therapy. Considering this principle of treatment, I have taken total Ayurvedic 8 drugs, and that is being named from the first name of that drugs. And 60 patients are randomly selected from OPD and IPD of Government Hospital Balangir. And there are 3 groups. One group having 20 patients. Group A is giving Ayurvedic compound. Second group is giving folic acid as a control drug, and third one is the combined drugs. And observational result, we have observed both subjective and objective parameters, and it is come to a conclusion that in group A 53.74%, and group B in only 5.67%, and group C about 68.56% improvement was being noticed after giving this 90 days of treatment. and statistically significant was more found in group C. These are the parameters we are taken into consideration as the sign and symptoms: anemia, jaundice, abdominal colic, palpitation, loss of appetite, sternal pain, fever, hepatomegaly, splenomegaly, body ache with crisis, repeated infection, repeated blood transfusion, pain in hip joints. All criteria was for every groups of patient, group A, group B, and group C. And it is come to the notice that the hemoglobin concentration before and after treatment was more found correct, that in group C, the before treatment it was 7.08, and after 90 days of treatment, it will come to the notice that it is about 10.09%. And in case of group A, where only Raktabasti is being introduced to the patient, on that case, there is also development of 1.5 blood concentration, hemoglobin gram percent also. You see, I have already told that a patient come to in my clinic having the avascular necrosis. On that patient is not interested to, for operation, so I take a opportunity to give him some Ayurvedic medicines. I think that why not a Panchayatita Grutu is meant for this pain threshold. So why not we can add the Majja. Majja means the bone marrow of the goat. So accordingly, 6 tablet 1 dose with a prepared bone marrow. We are preparing in the hospital and also given to this patient. The dose and duration was 30 ml daily for 15 days with the gap interval of 15 days for 3 times within the period of 90 days. The investigation, we have carried the investigation CBC, sodium, potassium, calcium, AHP, electrophoresis, X-ray before and after treatment. The administration of this therapy was started after proper Snehan and Swadhana applied as a Anubasana Basti. The indication was pain in the left pelvic joints, unable to walk properly, shortness of the legs, burning sensation over the left pelvic joint area. X-ray shows osteonecrotic and osteoporotic changes. You see, this is the assessment of the bone matrix after administration of the Majja Basti. Before treatment, you see there is fusion of this pelvic girdles along with femur, and after 45 days, you see there is some gap in between these joints, and at that time the pain and other things is simultaneously reducing. And on the day of 90, we are taken another X-ray, and that is easily visible that the joint is free from osteoporotic and osteophytic changes. So the patient is now still moving very nicely. But one thing I came to introduce you here, that there is the shortness of this leg is now continuing. For that, I have already told you that you prepared a show like that, which is equal to this another leg, and she is now okay. You see, another clinical trial has already been conducted with the hormomineral compound and Guruchi Sattva. We have taken 30 patients, and 15% is hormomineral compound, and 15% is Guruchi Sattva. That is the place of selection was the Government Balangir. The consent of the patient was also taken. These are the drugs. These are the subjective parameters we have taken into Panduta, Drobata, Sadhana, Angamarda, Jwara, Swasa, Aruchi, Gaurava, and Gatrasula. And objective parameters we have taken into the consideration, the DC, TC, ESR, CBC, along with the sickling test, PCB. And the ingredients of this hormomineral formulation was Guruchi, Swarnamakika, Prabala Pisti, Abravasma, Mukta Pisti, Sankhabasma, Mukta Pisti, and Rajatabasma. The combination was from my side. I think I have already taken into consideration so many patients, and most of the patients I came to notice that the patients are suffering from the disease only because of their less immunity. when only the seasonal variation, they came to my clinic for pain in extremities, for abdominal pain, for concentration of hemoglobin is day to day decreasing. For that, I think that some pitta pitta virechaka or pitta samaka drugs can taken into the consideration. So I made this hormonal formulation. On that formulation, I came to notice you hear that the mild improvement in group A is group A is given with this hormonal compound, and group E is given into the Guruchi Sattva. In group A, most of the patients are getting good result. One patient markedly improvement was noticed, and one patient moderately improvement was noticed, and out of that 15%, 10% as mildly improvement. As regards to the Guruchi Sattva, hormomineral compounds are acting more properly, and patient was at the time asymptomatic, and they are very helpful to getting this Ayurvedic treatment, and that is being published in International Research Journal of Ayurvedic and Yoga. You see, after that medicine, when we have a MOU with Delhi University of South Campus, when I was at that time at Bolangir College as a in charge principal and professor of Department of Rogonidano, at that time we are thinking that hormomineral compound and Guruchi Sattva is acting properly. So why not we come into a conclusion through a comparative statement of vitro study. So we are taking into the test in our mind. We are giving such type of medicines to the patient's blood. You see, the dilution application of this drug was made with a anti-sickling solution. The anti-sickling solution, Guruchi Sattva and hormonal compound, was being mixed with 9.9% sodium chloride solution, 1:1 ratio. Why 1:1 ratio? We have taken into consideration 500 milligram per 60 kg body weight will be taken into consideration as the 10% of the body weight is our blood concentration of our body. Accordingly, we have calculated this 0.9 sodium chloride solution. It come to a conclusion that 1:1 ratio will be the best one. This is one type of solution which can introduce to the patients in vitro study. You see, there are 4 samples. 2 samples. One is Guruchi Sattva having 500 milligram dose, and another is hormomineral compound in 500 milligram dose. There are 2 pictures taken from the ultra microscopic study. The before treatment in case of Guruchi Sattva 500 milligram dose, there is before treatment. This is the positive control. At 4 hours there is sickling, but after 4 hours in vitro study, it come to conclusion that most of the RBCs are change its fragility and come a regular form, and the concentration of this RBC was more during our study. In case of hormomineral compound, you see the hormonal compound was also given in 500 milligram in dose. Before treatment was same, and after 4 hours the concentration of the RBC is being changed. The sickling formula, sickling part of this RBC also being changed. So it is come to conclusion that 500 milligram of Guruchi Sattva along with a separate blood picture of hormomineral compound with 500 milligram dose in vitro study is acting properly. So our Guruchi Sattva along with hormomineral compound are acting properly. So there is a good observation here that our drugs are very nicely acting. As regards to the 250 milligrams dose, Guruchi Sattva 250 milligrams, you see the before treatment there is a sickling phenomena, After treatment, there is also sickling phenomena. The concentration of the sickling phenomena before treatment and the after treatment is somewhat changed. But in case of hormomineral compound, there is also changing as also seen in 250 dose. Why we are considering 250 dose is because some of the patients were coming to our contact having the childhood. And age because this disease is being started from the 2 years of the age up to the 18-19 years of the age. So on that case, what type of dose we are considering? According to that, we are considering the 250 dose milligram and 500 dose milligram. So this is about a very scientific study, in vitro study, where we can get that both Guduchi Sattva and hormomineral compound in adequate dose 500 milligram for 60 kg body weight, having a good result. Another study has already been conducted very recently. There are so many patients come to me having Plehodora. Up to the more than umbilicus, I have seen so many patients. So I have considered that Sarapunka is the best medicine. Why not we can take a research on that, and we are taking into consideration that Sarapunka Kharo and Sarapunka Ghanavati was introduced in 30%. Group A is introduced with the Sarapunka Kharo, and Group B is the Sarapunka Ghanavati. Sarapunka Kharo 500 milligram BD and Sarapunka Ghanavati 2 tablets 500 milligram each after food for 30 days. And it is come to the notice that effectiveness of subjective and objective parameters was noticed, but the subjective parameters was no so much effective rather than the objective parameters. In case of hemoglobin concentration, in case of reticulocyte count, in case of TLC and ESR, we are getting good result. You see the assessment in case of group A, the moderate improvement was seen in 40% patient, in mild improvement seen in the 53.33%. But as regards to the group B, the moderate, there is no moderate improvement, only mild improvement was seen in 11%. So it is come to the conclusion that this Sarapunka Kharo is more effective than the Sarapunka Ghanavati. Now ongoing clinical research on this sickle cell anemia is continuing. Out of that, Dr. C.P. Sinha is a PhD scholar from under my supervision, a clinical pathological study on sickle cell anemia and comparative management of Kiratotikta and Guduchi Sattva. As I have already taken into consideration, this Guduchi Sattva is more potent and having good efficacy to control this sickle cell anemia only because of its immunomodulatory activity and other rejuvenative therapy. So again, I make a comparison with the Kiratotikta. How Kiratotikta is acting properly or Guduchi Sattva is acting properly. It's because Kiratotikta is most tikta properties as regards to the Guduchi Sattva. Second one is the Sigru leaves and Sigru bark. It has been already been mentioned in our book that Sigru bark and Sigru leaves are helping in Panduroga. Considering this words from Ayurveda, this shloka from Ayurveda, this sickle cell patient treatment consider with Dr. Sudipta Bates, PG scholar, GSC Balangir, and now that is being continuing. And bark powder has already been introduced to the 20 patients, but leaves is taking into the consideration of the 2 or 3 patients. There is we are not getting good results in bark powders. If after completion of the study, it will become to the conclusion which bark is more effective or leaf is more effective. The third one is there is a comparative clinical pathological study on Panduroga with special nutritional deficiency or sickle cell and sickle cell anemia and its management with Amaloki body. Amaloki, we have a good knowledge that Amaloki is a Rosayana. So how Rosayana is acting properly in sickle cell anemia, that is our aim and object regarding this research. This is about this preparation of medicine of Guduchi Soto. We are not using the Guduchi Soto or other medicines from the market. We are properly preparing all this medicine in our pharmacy with proper medication, with proper rules and regulations, and that is being introduced to the research peoples. You see, this is about the Sigro leaves and barks. Dr. Sudhita Bej is now continuing the research as a PG scholar second year. This has been already published in foreign journals. That some of the journals I have come to notice that this moringa leaf is powder, also aqueous extract, is more helpful to this sickling patient, and it has a anti-sickling effect of this moringa leaf rather than the dry powder or aqueous extract. See, other drugs acting in sickle cell anemia is papaya also acting properly, aloe vera also acting properly, and bell, alga marmelas also acting properly, and osimang bacillium also acting in sickle cell anemia. The upcoming research will come to my knowledge that I will give these 4 drugs to the sickle cell patients, and taking into the consideration that either these drugs are acting properly or not. These are has already been taken into consideration in different parts of this India also. In case of papaya, they have cut 100 grams unripe papaya into small pieces, add 100 ml water, keep it 48 to 72 hours at room temperature, then ready to use. And after using, they are giving the dose of this patient 2 to 6 years 5 ml, and 7 to 11 years 10 ml, and 12 more than 12 years having 15 ml and getting good results. As regards to the aloe vera plant, also in boil and filter 1 liter of aloe vera gel and then 500 milligram jaggery, and the dose was like that up to 12 years 10 ml, 12 to 18 years 20 ml, and adult 30 ml, and no more symptoms after 1 week of this treatment. 260 patients treated with these drugs, and more than 2 years, and getting good results also. The third one is bello, and bello is also acting properly. Bell with piper longum also getting good result in case of sickle cell anemia patients. So 500 milligrams to 4 to 5 pinch of fine powder of bell tree fruits are taken into the consideration, and getting good result. Osimum bacillium, this is a tulsi from Indian tulsi that has already been researched in different parts of this India also. Anthocyanin is a acting principle inside this tulsi, which act properly in vitro study. They have already taken into the concept, which we have already conducted in our study at Delhi University with this vitro study. They have already conducted that one and getting also good result. You see, after seeing different types of clinical research and my experience, the principle of treatment of sickle cell anemia to be like that, we are going to introduce by, we have to take the shelter of the immunomodulator medicines like Sotabari, Osongda, Tulasi, Nimba, Guruchi, Haridra, Punanaba, and Pipoli. As regards to the Rosayana medicine, Amaloki, Haritaki, Osongda, Silajotu, Pipoli, Bhaladago, Sotabari, and Nagobala can taken into the consideration. Hepatosplenomegaly, Kalamego, Kiratoticto, Soropunka, Karo, Soropunka Ghanamati also can taken into consideration. As regards to the digestive and carminative medicines, Chitraka, Sunti, Twak, Jira, Pipoli, Moricho, and analgesic medicine, Rasnadi Gugulu, Panchadita Grutu Gugulu, Troidosa Gugulu can be taken into the consideration. Main things that we have to advise to the patient to take plenty of water, which help to reduce the dehydration of this body. When there will be chances of dehydration, there may be chances of vaso occlusion, and when there is vaso occlusion, there is chances of pain and infection on that particular part and aggravate the disease. You see, for this sickle cell anemia, we have I have previously make a MOU with Delhi University of South Campus when I was at Balangir Ayurvedic College, and at that time I have conducted the research work which has been seen you in this PPT also. After that, when I joined here as a Dean, Sri College of Ayurvedic Science, again with the consultation of the director, Professor Kundu of Biotechnic Department of University of Delhi, he came to our college and he told me that if your laboratory is fruitful for this research work, then I will make a sign in your MOU. And this is the pictures. The total the two MOU is being taken by one is our executive register, and the tallest person is our vice chancellor, and the left side of this vice chancellor is our executive register. Left side of the executive register, there is the director of Delhi University, Professor Kundu, myself, and in my left side there is a medical officer of our college, Professor Das, and left side of the Professor Das there is a research officer, Mr. Sai, and in the last there is the Shruti, is the research officer from Delhi University, and side of the Shruti there is the director of Vice Chancellor Office, is a Professor Tripathi, is the faculty of emerging medicine. So he is also contact with us as regards to this. You see, after a MOU with Delhi University, we are going to start a research work on saline HBS. Is totally herbal drug. We are unknown of that herbal drug is because now it is continuing as a double-blind study. Everything is being conducted. The ethical committee is being formed, and within a short time, this research work being continuing in our institution. Another MOU has already been signed. This 26th August 2022 regarding different clinical research at our university, and we are also hopeful that in with Sarvottam Care Limited we can also try our level best to take some drugs, herbal drugs, for this clinical research in sickle cell anemia. It is now the conclusion part come to our mind that many of the plants are effective to treat the symptoms of sickle cell disease. We don't know about the exact mode of action and the dose of this all the plants. Preparing medicines is easily possible. Sometimes even at home, no side effects are reported in total procedures of my research tenure. Plants can prevent crisis of sickle cell disease and prolong life. Use Ayurveda and save life. Thank you all. Thank you opportunity to give me in this our Roganidana Parisada, that in my tenure of 28 years as a faculty of different Ayurvedic colleges of Odisha, and taking into the consideration of a tribal belt, I have continued 28 years there, and I came to my notice that most of the patients are suffering from anemia, and from that things come to mind that why not we will take the consideration of different Ayurvedic medicines which are acting as a rejuvenator, immunomodulator, antipyretic, like that. So I have taken into the consideration of different medicines which is being in put forth here for your knowledge. Thank you all.
Thank you, sir. Thank you very much, sir. I request Dr. Anukul Chandrakar, sir, to have concluding remarks.
Anybody, any
Sir, I
queries?
want to add something.
Anybody, any queries? Anybody want to add something?
Sir, I want to say something.
Yes, yes, please. Yes.
Yes, yes.
Yes, sir. Sir, Panda sir, namaste.
Namaste, namaste, sir.
Sir, myself, Dr. Sandeep from Parul University.
Yeah, yes, sir. Yes, sir.
You have a wonderful speech. It is what I say, all corners you touches and a very beautiful synchronization of the knowledge. And what I get, sir, here, the classical text, it is explained that whenever you treat the patient, you have to treat the tactoid granule cell related pH, acidic pH balancing should be there.
Yes.
And for bone marrow stimulation to produce the good RBC, there is a use of folic acid, and better formation of folic acid, there is a need of B complex for the development of RBCs. So nutritional folic acid, and to maintain the acidic pH due to tactoid granule formulation, we need in classical text they said you have to use 2 grams of soda bicarb, medicated soda bicarb,
Yes,
to
yes, sir. Yes.
lower down the acidic pH of that blood. And when I listened to you very carefully, that I noticed that Sharapunka Kshar is better than Sharapunka Ganavati. So this Kshar is again going to balance the acidic pH of the blood to alkaline. And somewhat extent, you explain that Guduchi Sattva and herbomineral compounds, they are both good to maintain the life and anemia of that patient, not to the lower side. And this agglutination, or what we say clumping,
Sir, your voice is breaking.
clogging, thickening. So what I think, sir, some so
Yes,
I'm
yes.
audible, sir? I'm
Yes,
audible?
yes, sir. Yes, sir. Yes,
Your
sir.
voice is
Yes,
breaking
sir.
in between, sir.
Okay, sir. But my idea is clear, no, sir?
Yes,
Yes,
sir.
yes, sir. Very, very good idea. Very good idea. Yes, sir.
So somewhat extent, sir, you are so good that you found that acidic pH how to reduce by the means of this char,
Yes, sir.
Yes, sir.
Guduchi Sattva and herbomineral compounds. Sir,
Ah.
but in my idea, why do you choose NaCl as an isotonic content better than you use some what we say alkaline management related some salts, that is soda bicarb vagera? That should be a better combination for your herbomineral combination rather than sodium chloride. What I think, sir?
नहीं, definitely.
मेरी अल्पमति से मुझे जो समझ रहा है वो.
Yes, 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 because sodium chloride is easily easily
Sir,
assimilated to our body. It is one type of rehydrating therapy like that.
इसी में
we
हम
are
उसे
using in our,
आइसोटोनिक सॉल्यूशन के लिए यूज करते हैं.
yes, 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 sir.
Okay, sir. I think which I miss here, sir, that is sickle cell anemia awareness drive.
Yes.
You explain sickling test with the reducing chemical substance for the detection of precipitation, how much precipitation was there. If it is poor precipitation, then it is sickle cell anemia. If it is trace or 1 to 2, then it is sickle cell trait. So we have these campaigns among the youngster, especially at the college level. And if somebody found that he is having sickle cell trait, we advise them in Maharashtra, it is in practices, he should not or she should not marry with the same sickle cell trait suffering person. Neither their offspring will be definitely have a sickle cell. So this is the one thing which is prevention better than cure should be added there. And sir, this is the wonderful, but one thing I want to ask you, what is the best? Rakta Basti is best or Majja Basti is best, sir?
Sir, Rakta Basti helps to increase the level of the hemoglobin. But in case of Majja Basti, it helps to increase the body immunity powers, which randomly help for reducing the pain.
Sorry. Whatever you said, I agreed. But there is a abnormal hemoglobin formation.
Yes.
And there are Thais, Nigerian, and some furthermore subtypes of this sickle cell anemia.
Yes, sir.
and one is fetal. It have polycythemia like higher HB, but there is no need of hematonics. Literature
Yes.
said that if the person is having 8 HB, 8 to 10 HB, no need to give hematonics. It is contraindicated. And
Yes,
this
sir.
is the anemia which is having contraindication for the hematonics. If it is less than 8, then you will prescribe. Even they said it is less than 7, then you can able to use hematonics, neither nor. Just give folic acid and multivitamins and maintain the acidic pH by soda bicarb. So in Gujarat, sir, what we found, there is a practices that person maintain these acidic pH with different char.
Yes, sir.
Your voice is breaking.
Hello.
Hello.
And immunomodulator, whatever, because these oxidants are there. I want to add majja basti, that is aja bone marrow, means बकरी का जो पैर का सूप होता है उसको बॉईल करके उसका बस्ती ज्यादा रिजल्टिंग है फॉर मेंटेनिंग दिस porphyrin ring rather than
Yes.
and
That is good. That is
so this is
very
the
good idea
prevention
for
of that sickling test. Yeah, sir, that is all from my side, but this is the wonderful mind opening, very nice.
In your suggestion will be incorporated in my research work. Definitely, it gives a one
sir,
line.
अल्पमति से जो हुआ मैं बता दिया sir.
Yes, sir.
Yes.
Very nice, sir. Very nice.
Sir, I am impressive. Very nice your lecture is.
Yes.
So I think we will conclude now. So thank you very much, Dr. P.K.Panda sir, for giving this wonderful lecture on sickle cell anemia. I think it is an eye opener to all of us, that how in a small establishment this type of research can be done. So your vast experience of 28 years experience, association with the patients, and your experience will give us a very good idea to conduct further research. And I hope that the MOU we have signed with these two important institutions will give more information and more scientific works to prove that Ayurvedic medicine is working in sickle cell anemia. So and I can say one thing, that this those diseases which are not described in Ayurveda, that can be treated with the principle of Anukta Vyadhi by analyzing the dosha and dusya and the pathogen samprapti ghataka. So we can have a, so by the Dr. Panda has used this principle by selecting this analgesic and hematinic if required, then immunomodulatory drugs, Pittarachaka drugs, and this Rakta Prasadakar and Rasayan drugs. So I think this is the very important lecture we have today. And with this remark, I concluded that everybody would have learned so many things, and there is a great input from Dr. Sandeep Dailekar. So thank you very much. Thank you all.
One thing, sir, I came to notice that another study is being continuing at Delhi University Biochemistry Department. After when we see that the chemical bonding of Guruji Sattva is equal to the chemical bonding of hemoglobin in silico study. One study is being continuing that in silico study. In silico study means the chemical bonding of Guruji Sattva and the chemical bonding of hemoglobin mighty is somewhat 80% is equal. So easily the chemical substance is being taken into the consideration, and when we are taking in our body as a medicines. So I think Guruji will be the best one, which helps to develop the immunity as regards to the sickle cell patient also.
Okay, Guruji act as both immunomodulator, Rasayan, and everything. I think Guruji is a very good quality. Okay.
Yes.
Okay, thank you.
Okay, thank you very much, sir. So with the permission of today's guest speaker, Professor Panda sir and Anukul Chandrakar sir, we would like to conclude today's lecture.
Okay, thanks.
Can we wrap up?
Yes, sir. Okay. So next lecture will meet on next 10th of this month. Okay.
Yes, sir. Okay. Okay, sir. Thank you, sir.
Sir, congratulations, Anukul कार सर, एकदम बढ़िया lecture arrange किया.
Okay, thank you.